Bilateral tubal occlusion, commonly referred to as tubal ligation, is a surgical operation that entails the blockage of the fallopian tubes, which are the tubes that carry eggs from the ovaries. This effectively prevents egg and sperm from meeting. In this way, pregnancy is avoided, since fertilization occurs precisely in the fallopian tubes. It is considered a permanent, or in other words, an irreversible method of contraception. However, there are several techniques available to achieve tubal occlusion, including the complete removal of the tubes. This issue holds considerable importance, since it could impact the future ability to reverse a tubal ligation in cases where the woman later wishes to have children again. Among the main positive aspects of tubal ligation is the fact that it does not interfere in any way with the natural menstrual cycle. Additionally, it allows women to avoid the constant worry of contraceptive methods, whether hormonal methods, such as the pill, or barrier methods, such as condoms. However, tubal ligation also has certain disadvantages. In addition to the risks associated with both anesthesia and the procedure itself, we can also mention it does not protect against sexually transmitted diseases. There is a possibility of spontaneous recanalization and unwanted pregnancy. In addition, there would be an increased risk of ectopic pregnancy. On the other hand, the fact that it is a method of contraception that is permanent can also be a disadvantage in the case that the woman decides she wants to become pregnant again. In the labels, I have included an article where you can find a lot more detailed information about tubal ligation. Although the decision to undergo tubal ligation should be made with the clear and firm understanding that you do not want to have any more children in the future, it is true that circumstances can change and women may come to regret their decision. As a result, the inquiry about the irreversibility of this surgery is unavoidable when a woman contemplates having it done. The truth is that there is indeed a reversal surgery called tubal repermeabilization or tubal reanastomosis. From a technical standpoint, this surgery is more complex and intricate than tubal obstruction, as it aims to recanalize the fallopian tubes. However, the possibility of performing this procedure and becoming pregnant again will largely depend on several factors. One is the woman's age at the time of repermeabilization, since age decreases the possibility of achieving pregnancy naturally. Another factor is the type of obstruction that will be performed on the fallopian tubes, since at least 4 centimeters of the tube must be preserved. In spite of this, having a tubal reanastomosis does not assure in any way that a natural conception will be possible. When tubal ligation cannot be reversed, or even if it can be reversed but fertility problems exist that would make it difficult to achieve pregnancy naturally, then assisted reproductive techniques must be used in order to increase the chances of conception. In this case, artificial insemination would be completely ruled out as an option, since fertilization could not occur due to the blocked fallopian tubes. Consequently, it is necessary to turn to IVF. I am providing you with a link to an article that contains a lot more information on how to reverse a tubal ligation.